So, good evening, friends. We'll start with today's session. In last lecture, we have discussed regarding the aphorisms number 89 and 90. The two important things which he has mentioned over there. The first one, that is the after completing the history, more precise special questions should be asked in order to complete and furnish the case. And then the most important aspect in the case taking is the observation, the clinical examination of the patient. And that he has explained in the aphorism number 90. And with the footnote, he has mentioned what to observe. And many examples of observations are mentioned in that footnote. So we are going gradually to learn this process of chronic test taking by the Hahnemannian point of view or from Hahnemannian point of view. Now we'll turn towards the new aphorism, that is the aphorism number 91, where he explains the importance of the past history also. What he says, the symptoms and feelings of the patient during the previous course of medicine do not furnish the pure picture of disease. But on the other hand, those symptoms and elements which he suffered from before the use of medicine or after they had been discontinued for several days, give a true fundamental idea of the original form of the disease. And this specially the physician must take note of. Underline this sentence, whatever is written in italics, before the use of medicines or after they had been discontinued for several days, give the true fundamental idea of original form of the disease. So when we deal with the patients, and where the patient's case is chronic, many times we get adulterated picture. We get the symptoms which are not the primary symptoms of the disease, but which are the symptoms which are mixed together with the primary symptoms of the disease along with some medication patient has consumed. And because of medication, the symptom which has been changed. And that's why you cannot get a right totality of the symptoms. Hahnemann says it is the best method to ask the patient regarding the what past original primary symptoms of the disease before taking any medicine. So ask the patient how the disease has started before taking any medicines. What was your picture? What was the problem with which you are suffering from? Because that gives you exactly the functional symptoms, and functional symptoms are always the individualistic symptoms. Let me clear one idea. For example, a patient comes to you with eczema and he is having the eczema on the hand. That you ask him, what is your problem? He explains, this is the problem. And he explains, it is since last 5 years it is there. So what is the problem? It never looks good, that's all, but it is troublesome, it irritates me, that's all. If you ask exactly how it was to start with, then you get a rather different picture. Now he doesn't have so much of symptoms. It is only objective symptom which is there. And if you open the repertory in the chapter of skin or extremities, eruptions, eczema, and you don't have a modality, there are many remedies mentioned under that. But if you ask the patient that how it was to start with, this is too important. What has happened exactly before applying any ointment to it? Before taking any allopathic medicine to it, what was the picture? If he recollects, you can get the functional symptoms more strongly. Patient explains that this problem I have started 5 years back. Doctor, at the start, there was severe itching. I used to scratch and scratch. I get a lot of burning. But one thing was there, that when I used to keep that in hot water, I used to feel better. That was the first thing. Then I went to different specialists. They have given many ointments. I have tried variety of ointments. Yes, whenever I used to apply the ointment, I used to feel better. Sometimes it has disappeared and again reappeared. But what has happened? Now it is not going. It is there. I don't have so much of trouble of it, but it never looks good. It's on my hand. See, here you don't have a symptom which is characteristic now, but it was characteristic to start with. At that time, it was functional. It was having sensation. It was having modality. And because of which it was easy to prescribe at that time. So you can come to the right remedy if you ask this history. So what is the remedy? Any idea? Simple prescription.
Arsenic.
Yes, arsenic album. Because the symptom was very characteristic when it was functional. But once it becomes pathological and more long continued, then it loses its special sensations, its modalities, and then it becomes rather difficult to treat. And that's why Hahnemann says those symptoms which are prior to the or before the use of medicines or after they had been discontinued for several days gives you true fundamental idea of original form of the disease. And this especially the physician must take care of. So this is what you have to look for. So in each and every chronic case, which is already on many medications, it is your duty to ask regarding original symptoms of the disease. And original symptoms are always more functional than it takes the pathological form. Patient comes to you many a times with some pathology. Patient comes to you with a severe headache, and headache is since last 4 5 years. And now recently he has done his MRI, and there he found some problem, some tumor over there. But to start with, 5 years back, he never have or had any specific thing. 5 years back, he never had a problem like this. But at that time, he was having very typical headache. He said, if you ask him how it was, at present, he is explaining, doctor, severe headache and I cannot bear it. That's all. That is the problem now. You ask him any specific, anything special about headache. He says, no, but I cannot remain without headache. But if you ask a precise question, how it was prior taking any allopathic medicine or anything, how it has started, and then he explains, doctor, I recollect the thing that when it has started 5 years back, I used to have every time one-sided headache. Many times it starts with right side. It starts from the either from the occiput and then comes and settles over one eye. Sometimes it goes from up front to go back, but every time there was one thing. First time, if it comes on right side, then it turns to the left. Again, it comes to the right. Again, it turns to the left. And that was very typical. But now it is not like that. Now it is continuous. And now the whole head is moving. So he has given something which was there prior to it, because that was functional. That was important. Remedy was there, hidden over there. Not in present state. Present state, you cannot get that. Not lilium tea. Which is the remedy? Any idea? Any answer? No. Shifting from right to left, left to right, again right to left, left to right. Simple remedy, very simple. Whatever may be the complaints, whether it is headache, whether it is sore throat, whether it is diphtheria,
Leg cancer,
backache, which is the remedy?
Leg cancer.
Yes, very correct. Very correct. Remedy is Laccaninum. But you get this remedy only on when the symptoms are functional. Once it becomes pathological, it becomes difficult to find it out. And that's why the first symptoms which are prior to take any medicine are always helpful in such types of situations. And that's why Hahnemann says this is too important. Then what he says, when the disease is of a chronic character and patient has been taking medicine up to the time he is seen, the physician may with advantage leave him some days quite without medicine, or in the meantime administer something of an unmedicinal nature and defer to subsequent period the more precise scrutiny of the morbid symptoms in order to be able to grasp in their purity the permanent uncontaminated symptoms of the old affection and to form a faithful picture of the disease. If patient is not able to recollect how it has started, what were the functional symptoms, what were the primary symptoms of the disease, then what he should do, the practical approach Hahnemann has explained. Patient's disorder is, if it is not of a severe character, and if it is patient is able to bear, if you can find it out, then he says that you must give him like a placebo of an unmedicinal nature, and just go ask the patient to come after 15 days or month and just find it out what is happening. Ask him not to take any allopathic medicine in between and keep him on the placebo. After 15 minutes, when he comes again, just find it out what is the present situation. Many a times, the symptoms which were suppressed now starts coming out again. And once they starts coming out, they are always helpful for the victim. Because that is an uncontaminated picture, again comes into surface. It again comes to the surface. And once it comes to the surface, then it is rather simple to find it out, the right remedy for the patient. And this is the practical aspect which he has mentioned regarding it. So, in this aphorism, he tries to explain the importance of primary symptoms of the disease or the functional symptoms of the disease, because those symptoms are always important to individualize the patient. And always patient starts any disease expressing in the functional form. Later on, the functional symptoms gets converted to the pathology, because there also applies the law of biological development. And law is very simple. Functions creates the organ. And that's why functions first are defined and then the organ is developed. Same law is applicable when this is developed. It first alters the function, shows the functional manifestation, and then it gets converted into the pathology or structural change. So it is always simple to differentiate one individual from another individual on the basis of functional symptoms. If a patient comes with a pathology, for example, hypertrophic tonsils, you cannot differentiate only on the basis of hypertrophic tonsils. But if he says what exactly the symptom is, what aggravates it, what ameliorates it, or if there are concomitants along with that, it is simple to reach to the remedy. So before pathology gets advanced, you get all those functional symptoms. Every pathology always precedes by the functional symptoms. And if it persists for longer time of duration, then it gets converted into pathology. And when it reaches to the pathology, then it never remains unique. Then it becomes common. Then you get common symptoms of that pathology which are not useful for your prescription. And this is the importance of this aphorism. So right over there on side, that past history of the original history of the disease is very important. So before taking any treatment, the original symptoms of the disease are always important for the prescription point of view for the homeopathic physician. So this is 91. Then he turns toward the 92. And what is 92? If you don't get such a pure picture. And if the patient is in severe condition, you cannot wait, give him placebo and wait. If such a condition is there, what you will going to do? See, Hahnemann was very intelligent man, and he was very conscientious. He used to think every way. He says that if you get such a thing, this is the practical solution. But if you don't have a time to wait for the patient is in a serious condition or his condition is troublesome, you cannot wait. Then what you will do? How to go ahead? And that's what he has explained. So one more practical solution for that he mentions in 92. See what he says. But if it be a disease of rapid course, and if its serious character admit of no delay, the physician must content himself with the observing the morbid condition, altered though it may be by medicine. If he cannot ascertain what symptoms were present before the employment of the medicine, in order that he may at least form a just apprehension of the complete picture of the disease in its actual condition, that is to say, of the conjoint malady formed by the medicinal and the original disease, which from the use of inappropriate drugs is generally more serious and dangerous than was the original disease, and hence demands prompt and efficient aid. And by thus tracing out the complete picture of the disease, he will be enabled to combat it with the suitable homeopathic remedy, so that the patient shall not fall a sacrifice into an injurious drug he has swallowed. So second common practical problem he has solved in this effort. Many times you get a patient who is a chronic patient but still have acute problem. He is in agony. His problem is in of a serious character, and he has already consumed lot of medication. And patient wants immediate treatment. I will share a case which is very useful for you. I think I have shared. I don't know, but just uh, 8 days, 9 days back, I had a case of a juvenile arthritis, and patient was there on steroids since last 1 year. He was just a young boy, 10 years of age, suffering from juvenile arthritis. It has started in lower extremity, in the ankles specifically. After ankles, then he developed the shoulder pain. Then he developed the mandibles over there last year, and then he was diagnosed a case of juvenile arthritis. They have done all other tests which showed negative. RA test was negative, then the HLA-B27 was negative, everything, and labeled as juvenile arthritis. And they started him on the prednisolone first and later with the deflazacort. And he was continued since last December. And now he was in between, he was better with the steroid, but steroid in low dose was continued. And all of a sudden, in this December again, he started getting the aggravation of the symptoms, even though he was under the same treatment. So they increased the dose of prednisolone, nothing worked. Then they have shifted to the Mumbai rheumatologist. Again, he asked to do investigation, and ESR was raised from 65 to 110. And now this case was there with me, and he was brought to me with by one of my another patient. And patient was in agony. The child was in agony. He was not able to walk. His right knee was swollen, and it was swollen like big swelling over there, that you are not able to watch that it is a knee. It cannot look like a knee. That much swelling was there. And he started getting vomiting because of more use of steroids and all those things. So I took his case and I have started him on the pulsatilla LM1, considering whole case taking. And I could not get all the symptoms, but only thing which I have considered, the patient was child was very affectionate. Second important, he was very mild. Third important, it was shifting rheumatism. He was thirstless. All those things on the basis of that, and there was a lot of effusion in his eye. So I considered the pulsatilla was a very good remedy. I started him on pulsatilla LM1. They were showing me every 2, 3 days, alternate days. The symptoms were not so complete during the case taking, but there was no chance that I can wait and then I will get a right remedy and then I will prescribe. This is not the situation. Situation was that he wants immediate relief and he wants the immediate attention basically. So you cannot give the placebo and ask for the patient to wait for some time and then we'll take a case and then we'll prescribe. No, no, there is no chance in such types of cases. Already he has changed doctors many times because of not getting the results. All the orthopedicians from Sangamner, they have treated him without any results. And then they shifted to the Pune for rheumatologist. And 1 year he has treated him with the steroids. And now they have shifted to the Mumbai. But problem was severe. So I kept him on pulsatilla LM1. I think LM, not LM1, LM11, I think I started with. And every alternate days I was observing him. So it takes long time. Today is 9 days. He was not able to walk, but now every 2, 3 days the swelling was reduced, then reduced, reduced. Today they have sent me a photograph, and now it is nearly about 90% swelling of the knee has reduced. But there was involvement of left ankle, but it is not so severe as the knee was swollen. It has gone from knee to ankle in a low downward direction in the reverse order, and second important from right to left. So I have considered the whole malady as it is. It is a conjoint malady, whatever may be the patient's original symptoms along with the present situation. Both things you have to take into consideration because you don't have a chance. You don't have a time. And today when I saw that fellow on the video, he was very happy. He was able to bend his knee completely and keep it, press it down. That was a good situation after 10 days. But it takes 10 days. But in such types of cases, you cannot ask the patient to keep on placebo. You have to start the remedy. And that remedy, you can find it out on the basis of original symptoms of the disease, plus the disease symptom, plus the symptoms which are created or suppressed because of the allopathic medicines and whatever may be the picture available with you, that totality called as a conjoint malady by Hahnemann, which is necessary to take into consideration and find it out anti-type totality and find it out a right remedy for the case. That remedy should be given to the patient and start with the treatment so that the acute state of the patient can be handled confidently with the help of them. So these are the things which the most practical, valuable entities Hahnemann tries to explain. He explains that how to go ahead. You see the nature of Hahnemann. He thinks a lot about the all the followers of him. This is too important. This is too important because these are both things which you have to take into consideration in such types of cases where you can get a right remedy. And this is called as a conjoint malady. And those symptoms are also important for prescribing point of view. So this is what we have learned in today's session, though two important aphorisms, where a practical solution he has mentioned regarding the treatment of the cases, chronic cases, where there is a changed picture after starting the allopathic medicine and how to handle it. If it is not of a severe character, and if patient is able to give you functional symptoms, it is always better. But if patient is not able to give it, and if it is not of a severe character, then you can wait, give the placebo and find it out the original symptom. And third thing, if patient's condition is severe and there is no chance to wait, then take into consideration the or both the things. the original symptoms plus the conjoined malady developed because of allopathic treatment and apply that to the patient. So this is what we have learned in today's session. We'll stop over here regarding the discussion. There will be a question and answer session. There was one question, I think, Nisha, she has asked something. So what's your question, Nisha?
Hello, sir.
Um,
While treating that boy of juvenile arthritis, you gave him pulsatilla. And during those 10 days, whether you stop that steroids or steroids were also continued.
Steroids are already discontinued by them because he was getting severe vomiting. No medicine, no painkiller was going. Since last 10, everything was stopped because already they have stopped. It was for me there was no chance to stop his medicines. Already they have stopped 3-4 days before coming to me because he was continuously vomiting and having a diarrhea. So that's why there was no need to stop. They have already stopped. And since last 10 days, they have not given any anti-inflammatory, not given any steroid. And he is coming out of that situation. I can show you the photographs which are there. Right from the first day, they are there with me. Just a minute, I will show them. You can watch them. Very known. This was, is it visible for you? Right knee and left knee, you can watch that.
Yes, sir.
Yes. And just 2 days photograph I will show you. They have sent one more photograph today. See this is the picture today. Now it is looking like a knee.
Sir, your screen is not.
Hmm? Are you able to watch?
Yes,
Yes,
sir.
sir.
Yes.
Yes, sir.
He's very much happy because it has changed a lot. The effusion has gone. Basically, effusion is totally lost. Effusion, whenever effusion is there in the joint, think of the remedy which has that effusion. Pulsatilla is the remedy where subacute inflammation is there, and that's why there is an effusion which enters over there in the joint. Effusion, whenever takes place, pulsatilla, bryonia, apis mellifica, these are very important remedies in such types of cases, and that's why that it worked in this case very nicely.
Sir, what about Kali iode?
You can, but you should not go on just a child's rheumatism or juvenile arthritis. It depends upon what you have to prescribe for the child, not for rheumatism. You have to find it out exactly the patient first. The patient was a pulsatilla, so don't go with the pathological aspect. So understand, because Kali iodide is good remedy for arthritis, no doubt. But you cannot directly go on the basis of pathology because with the pathology you cannot differentiate remedy. So any other question, query?
Sir, good evening, sir.
Yes, Dr. Rajiv.
Sir, is the rubric abrupt and impatience is one and the same or different, sir?
Abrupt and
Impatient, impatience.
no, abrupt is different. Abrupt is the nature. Abrupt is the thing which is done abruptly, which comes suddenly, all of a sudden. There is no thought, there is no thinking. The person generally happens to be a frivolous in such type of cases. He comes, whatever his movements are there, they are abrupt, all of a sudden. Impatience is different. Impatience you can observe. Patient is moving here and there. If he is there in your OPD outside in the waiting room, he cannot wait over there. He's continuously moving here and there, and he is asking how much time I will require, how when doctor will call me. He is not patient enough. That is impatient. Impatience sweat
Huh.
cannot. That is the rubric. But abrupt is the nature of the person. Abrupt is even in his talk you can find it out, abrupt nature. All of a sudden he talks you and he suddenly stops talking also. He suddenly goes away from that. That is the abrupt nature of the person. So abrupt
Okay,
is
sir.
rather different. Impatience is rather different. The person who is not having patience is the impatient. Okay.
Thank you, sir. Thank you,
Okay.
sir.
Sir, can we go with 6 or 3:30 other than millisiemens? You can, but you cannot repeat in centesimal. If you use the centesimal, the energy is much more with the centesimal. And that's why sometimes there might be an chances of aggravation in centesimal scale. And if you require that patient's susceptibility, if you judge and it is not too high, and then it is low, and you have to boost up susceptibility without causing an aggravation, the millisimal is always useful. Better to start with 50 millisimal in such types of cases. Because if you give the 6, no doubt sometimes, but sometimes it might aggravate the state. Sometimes 30 might aggravate the condition. You don't know, and you cannot wait. You have to give 3 doses and just wait for the result. But in case of LM, you can repeat it. I'm repeating it since that day and continuously. I asked them to make a daily 1 dose I have given. I asked them to prepare liquid, and whole day that liquid should be finished. That's how I used to give it. And they are preparing it daily and giving it for whole day. So LM is always better in such types of pathologies where you require a repetition. LM11 is where do you want result? I want result more at the internal level, not superficial level. That's why 11. One is more superficial. I don't want results at the skin level. I wanted it more at the deeper plane. That's how I have started with the LM11.
Sir, what about in nasal polyp cases, LM potency?
Good results you can get. You can repeat nasal polyp with the LM.
No, sir, means potency means from LM3, 5, like that.
You can start with one only. It is mucous membrane, most external level. External
Okay.
layer. Then you can start directly with LM1, then 2, 3. Gradually you go on increasing. Okay. So that's all for today. Thank you being
Okay.
there.
Thank you.
Tomorrow we'll meet with at the same time. Thanks a lot.